You know it by many different names: comfort, welfare, happiness. But all these terms are related to mental health. Knowing this and keeping in mind that so many different factors can affect someone's mental health, this week we'll examine what leaders in our community have to say about the importance of mental health. We conducted a diverse set of interviews from across Chelsea, which includes our city manager, Tom Ambrosino, State Senator Sal DiDomenico, Director of Operations of the Chelsea Housing Authority, Paul Nowicki, School Committee Member Roberto Jimenez Rivera, Superintendent of Schools Dr. Almi Abeta, Chelsea Public Schools Equity, Diversity, and Excellence Officer Dr. Aaron Jennings, CHS Parent Coordinator Jay Velez, Healthy Chelsea's Substance Abuse Youth Prevention Coordinator Yasmin Hung, and Pastor Eleni Mendez of the Revival International Center Chelsea. Together, these leaders represent many different facets of our Chelsea community, and they each offer a unique perspective on the importance of mental health to our city and young people.
Something I wish I knew about mental health when I was younger. Pretty much everything, because it wasn't something that was discussed, wasn't discussed at the dinner table. Even with mom as a nurse and dad as a Chelsea firefighter, mental health wasn't discussed.
When I was in high school in the late 1980s and 90s, people didn't really talk about mental health the way they do today. So if you were going through something, a lot of times you didn't know who to reach out to. If you had a trusted friend, maybe it was always through friends, or like my mom, I was really close to my mom. But a lot of times I think we didn't name it as mental health.
When I was young, the stigma was even much greater than it is today. So I wish that I had known about resources that would have been available to help me with my levels of stress.
It's tough growing up with a lot of stress on and a lot of peer pressure and a lot of expectations. People want you to succeed, and they want you to act a certain way, and there's a lot of pressure to fit in and make sure that you also have a lot of friends, but also succeed in academically in school. You're told to grow up fast.
High school students today are more conscious than my generation being in high school, particularly as it relates to mental health.
So when I was a teenager, the things that stressed me out the most were this idea that I didn't have a lot of friends, and so it was really stressful to find myself at times when I didn't really know who to hang out with or where to go.
I think it's important for the Chelsea community to talk about mental health, because mental health doesn't really discriminate. So it affects all kinds of people, regardless of their age, of their ethnicity, of their income level, of their educational level.
The things going on in the community, the peer pressure of drugs and alcohol, I think will always play a factor in every generation of kids growing up. But it definitely did for me in the 70s and the early 80s here in Chelsea.
You can't change the circumstances of your environment and your surroundings. My single mom made the best choice that she could make, and to us, the love that she gave us was a lot, and that's what actually kept us together.
I saw many people, many friends try to take their life, and when I was 14, I have this experience to be in a group. It was a very big group when we danced together, and sometimes we travel, and I saw many girls and boys so stressed, and I saw two try to take their life away, and suicide should not have it. Not for no one, but especially for a teenager or youth.
It's much more pervasive in society than people let on, because there is still the stigma attached to mental health, so people remain unwilling to talk about it.
So I'm a social worker. We believe in homeostasis of balance. We believe in, I believe in total well-being. One part of total well-being is mental health. Mental health, social, emotional, spiritual, financial, the whole gamut, the whole pie. and mental health is a part of that. And I think mental health is probably the most important out of all of those things.
You know, everybody at some time or another in life is probably going to have a mental health issue.
When I was younger, one of the things that I really wish I knew more of is the terminology around mental health. I think that sometimes we experience things, especially when we just don't have the words to put to them. And so this idea of like, what is a panic attack? What is anxiety? And what is stress even, right? Even something as simple as stress, what does that mean and what does that look like? I always was the kind of person who would try to play things off and like, oh, I'm feeling fine. But then looking back on it, I do realize that I was putting a lot of pressure on myself for especially something like going to college. I really wanted to leave my home island of Puerto Rico to go explore somewhere new. And that is not something most people in my school wanted to do. So it was something that was kind of very out of the norm. And so I now look back at myself and realize that I was really putting a lot of pressure on myself for that.
Well, mental health's very important to me because it affects so many families, including my own. My family has a history of mental health issues. Both my father, when he was alive, and my brother today, both been hospitalized multiple times for mental health issues. So it's a significant issue in my own family. My ex-wife, the mother of my daughter, was hospitalized for mental health issues. So there's a lot of mental health issues in my family. I've seen firsthand the sort of toll it takes on a family. And so it's important for me to work to ensure that there are resources available for people who are having similar mental health problems.
I did experience some postpartum depression and didn't really know what to do with it at first until I started asking questions. And we didn't have the internet back then to just Google something and say, well, what's going on?
We have to normalize it. We have to let people know that in some shape, form, or another, all of us are dealing with mental health issues. Some may not be as severe as others, but we all are carrying something. People need to be caught up on what's going on as it relates to mental health. This is real. It isn't going anywhere anytime soon. So it would behoove us that we all know, not just a thing or two, but we all know where we can get resources and help and support from.
Folks in Chelsea need to know that there's many people that want to be helpful, and this is totally normal, and there's no stigma attached to this, and there's no shame in asking for help.
The role that I play now at Chelsea High School, I could resonate with a lot of the families of what they're going through, right? The sacrifices, the parents working that 3 or 4 jobs to provide for their families. This has opened the door, or it opened parents' perspective or caregivers to say, I need to know more about mental health, because it does affect our daily lives, how people act, think, feel.
We want to make sure that people understand that mental health is important, and we want to normalize conversations about mental health so that people don't feel that this is something to be ashamed of.
The Senate has taken the initiative to break down the barriers of mental health. So we have a mental health parity bill that we passed in the Senate to show people that we're committed to providing the services and taking away the stigma as well. We have now put together a system, a public health system, where mental health is valued the same way as public health, and increasing, the hospital capacities and the mental health services that we have done across the state.
Thanks for tuning in. Next week, we'll speak to students, as well as recent CHS graduates, about their perspective on this important issue. In the meantime, please remember to slow down, take care, and stay healthy, Chelsea.